Hi and welcome. My name is Dr. Sam Sunshine and I'm your host. And we're going to be having another podcast today. And today's topic is going to be hypertension or high blood pressure. And as you know, April is Heart Health Month, and that's why we're choosing that topic. Again, if you're interested in certain topics, please let us know. You can just simply text us through the Spruce app. And again, for those of you who are members of our direct primary care model, the Spruce app is our primary method of communication. So we recommend that patients use that to give us messages. All right, so without further ado, high blood pressure is very common. And one of the ways that we can monitor our own blood pressure, and I think if you're over 20, you should think about owning a blood pressure cuff. And I just checked mine just a second ago, 123/87, not great with a pulse of 70. It may be that I'm a little nervous, but this isn't Omron. It's just a, home digital blood pressure monitor. When you put one on to check your blood pressure, a cable is going to go down towards your wrist, and it's Velcro. If you have big arms, you want to get an adult large. If your blood pressure cuff is too tight and your arms are too big for the cuff, it's going to give you falsely elevated levels. And vis-a-vis, if your blood pressure cuff is too large and you have skinny arms, it's going to give you a falsely low blood pressure. Okay, generally you want to check a couple times a week and check at different times of the day, not just when you wake up in the morning or before you go to bed. Our blood pressure tends to be a little bit high in the morning when we wake up, and then it generally comes down and then goes back up as the day goes on. And there's certain things we'll talk about that raise blood pressure. And certainly coffee in the morning can do that. So I'm going to share my screen and we'll get started here. But I want to thank you for being here and listening to today's version of our talk. And I enjoy doing this. I'm doing it once a week. And again, if you have topics that you're interested in, please let us know. So hypertension, we're going to talk a little bit about what hypertension is and what you can do about it. It's kind of faint, but if you can see in this picture, there's a blood pressure cuff, there's a person's arm, and behind there is an apple. And most of you know or are familiar with the expression, an apple a day keeps the doctor away. I think it was originally coined by Notes and Queries magazine. And the original quote went as, eat an apple on going to bed and you'll keep the doctor from earning his bread. I thought that was kind of cute. So when we look at apples and cardiovascular disease, there was actually an article published in 2015 in the Journal of Nutrients, and it was titled Apples and Cardiovascular Health, Is the Gut Microbiota a Core Consideration? ? And it goes on to say that there's considerable scientific evidence that a diet rich in fruits and vegetables, those are the things that are grown in the ground and on trees, can improve human health and protect against chronic diseases. However, it is not clear whether different fruits and vegetables have distinct beneficial effects. Apples are among the most frequently consumed fruits and a rich source of polyphenols and fiber. And it went on to say that there is some supporting evidence to suggest that apples and apple components may benefit cardiovascular risk factors. The strongest effects seem to be due to lipid metabolism, and evidence has shown it can reduce total cholesterol. It is a prebiotic as well with the fiber, and it can impact also cardiovascular risk reduction, and they think it might be due to its effect on the microbiome. And so that's something that is important, and that's something that I'll save for another topic. We'll talk about the gut microbiome and how that affects all aspects of our health. And there's the gut-heart connection. And people who have a fortified intestinal tract usually have lower risk of heart disease. All right. So again, when you're checking blood pressure, the idea is to keep your arm about the level of your heart. Your heart is about the size of your fist, and it sits in the middle of your chest. And you want to be calm when you do it. You don't want to be hurried and then sit down and then get your blood pressure done. Typically though, if you raise your arm up, it can lower your blood pressure. And if you keep your arm down, it might raise your blood pressure a little bit. So kind of keeping it at the level of your heart. Just another point I wanted to make. So when we talk about hypertension, I think a lot of people don't realize how common it is. 1 in 3 adults, when I guess I say adults, probably over the age of 50, I would say it's closer to more than 1 in 3. When you look at those, I think 20 and older, I think data shows about 80 million people in the United States who are over 20 have hypertension. So that would be 1 in 4 total, but it's usually about 1 in 3 adults. And about 1 in 4, about 25% have what's called prehypertension, and I'll explain what that is as well. And then 1 in 5 adults have high blood pressure and they're not aware of it. Again, it's a simple tool just to monitor your blood pressure using a home blood pressure cuff and checking it periodically. And then 7% more Americans will have high blood pressure by 2030. That's a research estimate. So again, it's worth checking your blood pressure. If it's high, we'll talk about things you can do. So hypertension and risk factors. Again, hypertension is a blood pressure greater than 140 is the top number, or greater than 90 is the bottom number, and that's read as millimeters of mercury. Prehypertension is a blood pressure 120 to 139 and over 80 to 89. Either one of those is considered prehypertension. So again, if you're say 115 over 85, that's still prehypertension because your bottom number is in the 80 to 89 range. And a lot of times when I see people in the office, they'll come in and they'll feel maybe anxious, or they may not overtly feel anxious, but we check their blood pressure in the office, it can be high, then they go home and monitor it and it's normal. So I put more weight on what it is when you're at home and you're in familiar territory. Sometimes being in a doctor's office can add an element of risk and increase your blood pressure. So what are some risk factors? Again, diabetes. People with diabetes generally have higher blood pressure. Obesity is directly correlated with hypertension. Again, I'm using hypertension and high blood pressure interchangeably. They're synonymous with each other. Smoking and vaping can increase blood pressure. High salt diets. So if you're a salty intake person, you enjoy salt, that can raise your blood pressure in about half the people. A lack of physical exercise, or if you're sedentary or a gamer, that can raise your blood pressure. And then excessive alcohol consumption, that's different for everybody. Again, generally, if you're having more than a couple drinks a day, if you're a man, or more than 1 drink a day, if you're a female, that can impact your blood pressure in a negative way. So what are some signs and symptoms of high blood pressure, or again, hypertension? Most people are asymptomatic. Very few people will come in and have symptoms of hypertension, but some of the symptoms could be headache, swelling in the feet or ankles or hands can be a sign of hypertension. Visual symptoms, maybe blurry vision or changes in visual acuity, can be a sign of hypertension. Having a mini stroke or these transient ischemic attacks, you may have have a parent or a grandparent who's had one of these. Certainly there's a high correlation between having a mini stroke and hypertension. It's almost exclusively seen in those types of people. A shortness of breath or chest pain can be a symptom of hypertension. Palpitations or racing heart, again, can be also associated with hypertension. Or exercise intolerance, where maybe you feel like, gosh, I just went up a flight of stairs and I'm just short of breath. Or normally I can, run a mile easily and now I'm just really struggling. That can be a sign of hypertension. And you want to get that checked out. Again, if you don't have your own cuff, come see us. We can monitor that for you. So what are some risk factors? What puts us at risk for developing hypertension? Again, kind of mentioned this before, but smoking, number one, for sure is number one risk for number one cause of increasing your risk for cardiovascular disease. Having an elevated LDL cholesterol, which is the lousy cholesterol, or having a low HDL, which is the healthy cholesterol. Again, as I mentioned earlier, having diabetes is a risk factor for developing cardiovascular disease. Again, obesity, which is defined as a body mass index of greater than 30 kilograms per meter squared. Being a male in the United States and over 55, or a woman over 65 is a risk factor for cardiovascular disease with hypertension. Protein in the urine is a kidney function measure, and that could show underlying injury to the kidneys, which oftentimes is caused by either diabetes or high blood pressure. Family history of premature cardiovascular disease, that's having a brother or a father who has a cardiac event like a heart attack before 55, or a sister or mother who has a heart attack before 65. And then being sedentary, it does increase our risk for heart disease if we have high blood pressure. So lifestyle modifications that we recommend to patients is really, first and foremost, if you smoke, is what can we do to help you quit smoking? Could it be using a pill called Chantix? Could it be hypnotherapy or using patches, chewing gum, things like that? Have had a high success rate. One of the most successful interventions to help people quit smoking is 1-800-NO-BUTS, or these quit smoking hotlines that are free. People can get counseling online or on the phone. Losing weight. I do see in some people there's a direct correlation between, as their weight goes up, so does their blood pressure. And vis-a-vis, if their blood pressure goes down, if their weight goes down, their blood pressure follows. Limiting alcohol intake, again, huge for some people. A lot of people find that just having a couple glasses of wine is no big deal. They don't really think it's affecting them. But I've had many patients in the past who just quit drinking because it's not something they necessarily enjoy doing, or they share a bottle of wine with their spouse and just don't want them to feel like they have to drink alone. They stop that consumption of alcohol. Could be wine, beer, or spirits, and their blood pressure comes down, and we have to take them off their blood pressure medicine. So ingesting adequate amount of dietary potassium, calcium, and magnesium. And I'll talk a little bit more about the benefits of potassium in particular. Increasing fruit and vegetable intake. Again, that's where we get a lot of our micronutrients, and super important to get 4 to 6 servings of fruits and vegetables a day. Reducing saturated fat and cholesterol intake if you're eating a high amount of saturated fat and cholesterol. You don't want to eliminate all fat. We need fat in our diet, but people who consume too much fat, certainly the trans fats and the hydrogenated oils, are very toxic to our body and do increase our risk for inflammation. And then participating in exercise. The Surgeon General recommends 150 minutes a week, which is 30 minutes 5 days a week of moderate exercise, or about 75 minutes per week of high intensity exercise. That's the minimum. Really, I try to get people to work up to an hour a day, but vary their exercises, working on things like balance and strength and flexibility, as well as cardiovascular fitness. And things like yoga and meditation. Again, back in the 60s, there was a Dr. George Benson, who's a cardiologist at Harvard, who did publish a couple papers showing that meditation lowered blood pressure. In my practice, I do see an increased risk of blood pressure in patients who are stressed all the time. And I can tell that when they come in, they're just constantly looking at their watch. They've got to get going. They've got so many things going on. I think trying to tap the brakes and slow down our life, I think is good advice. I think it does reduce our risk for cardiovascular disease and high blood pressure or hypertension. And again, it's been shown clinically. So something to think about. So really, here's a summary of the treatments for hypertension. I do have several patients that say, "Doc, I've done it all. What's wrong? Why can't I lose weight? Why can't I get my blood pressure normal?" But weight loss is a big factor and is tied into hypertension. Eating healthy, again, fruits and vegetables. Dr. Barry Sears once told me that if we can eat 2 pounds of vegetables every day, we will not have hypertension. And that may be true. If you've ever heard of the blue zones, there's 5 cities or areas of the world that don't have any heart disease. They don't have hypertension, and they tend to eat a lot of fruits and vegetables and lean meats, and they stay away from highly refined, highly processed foods. Physical activity, again, can't be understated or overstated enough. It's so important to get exercise. It benefits every aspect of our body, every organ system. Limiting alcohol consumption, as I mentioned. And in those people who try what we call first-line therapy, which are these 4 initial things, and they just can't get their blood pressure down, and I think it's better at best to go on medication to lower it. Studies have shown the longer you have high blood pressure, the higher your risk of having a heart attack or a stroke. So you don't want to just play around with, yeah, my blood pressure is high, but I don't have any symptoms, so what's the big deal? That's the wrong approach to take. So what's the food blood pressure connection? So I'm going to, again, busy slides here. I'm going to try to summarize these, but this is from the Current Opinion of Cardiology from July of 2018. And this is a courtesy of Steve Holmes, our nutritionist. But the role of diet for prevention and management of hypertension. Again, a lot of people don't believe that what you put at the end of your fork affects how you feel or your blood pressure or your cholesterol, but it's super important. This is really probably the number one thing I think is to try to take home from today's talk is that we are what we eat. So the purpose of this review is to look at the regular consumption of diets high in sodium, which is something we want to limit, and energy dense foods. We don't want energy dense, we want nutrient dense foods, fat content and refined carbohydrates, added sugar, and that's low in fruits and vegetables, and how does that contribute to increased risk of developing hypertension? And kind of jumping to the summary, but adopting a diet rich in plant-based foods, whole grains, low-fat dairy products, and sodium intake within normal limits, which is generally less than 1,500 milligrams a day, can be effective in prevention and management of hypertension. And these diets have been found to be more effective in older adults and people with hypertension, particularly in studies that provided meals or frequent dietary counseling. So again, working with a nutritionist, health coach, super important if you really want to get down to self-analytics. You can actually follow and calculate sodium, potassium intake. The one free website I like is called Chronometer, Chronometer, chronometer.com. And you can plug in your food. You can do maybe 2 meals during the week and 1 meal on the weekend and see what your sodium intake is per day. And try to keep it under 1,500 milligrams if you can. Here's another article, again, kind of a busy slide, but I'll kind of just summarize it for you. But this is from the Journal of Geriatric Cardiology, 2017, looking at a plant-based diet and its association with high blood pressure or hypertension. And what they found, approximately 80 million Americans 20 years of age and older have hypertension. Again, it's a major risk factor for heart disease and stroke, which are the 2 main causes of death in the world now. And so there's a reason for wanting to lower your blood pressure. It's to extend your life expectancy. And that's what we're all about. It's about not just feeling average, but feeling optimal. And that's what my practice is all about, is trying to get people to understand the importance of blood pressure. It's important. It's something we need to be aware of. If someone were to say, hey, what's your average blood pressure? It's something you should be familiar with. And if you're not, these are very inexpensive. When I first started in medicine, blood pressure costs were $300. Now they're under $50. So pick one up. And again, kind of a summary from this Journal of Geriatric Cardiology, looking at a plant-based diet, found that first-line therapies, again, that's diet, exercise, limiting alcohol, and stop smoking, include exercise, weight loss. However, results from one cross-sectional study suggest that a plant-based diet alone is the more important intervention. So when comparing a plant-based diet, again, rich in fruits and vegetables, is probably the most important when you compare it to these other first-line therapies. All right, so here's talking a little bit about salt. And this is from, let's see, The Advances in Experimental Medicine and Biology, which is a peer-reviewed book series on contemporary research. And this is looking at the impact of salt intake on the pathogenesis and treatment of hypertension. So pathogenesis is the creation or cause. And this is, again, fairly recent, 2017. And it showed that excessive dietary intake is associated with an increased risk for hypertension, which is in turn is especially a major risk factor for stroke and other cardiovascular pathologies, mainly heart attacks, but also kidney disease. On the other hand, a reduction in dietary salt intake, again, sodium chloride, it's the stuff that you add to salt, a lot of us add to food, leads to a considerable reduction. So again, reduction in salt intake leads to a considerable reduction in blood pressure. Concomitant to salt reduction, potassium intake, increasing potassium intake, which we can get from fruits and vegetables, should be optimized. So aim for eating a high potassium rich diet, about 5 grams a day. And several studies have provided evidence that potassium rich diets can lower blood pressure. So again, potassium's good, sodium's in moderation. High sodium intake, bad. And then regular physical exercise, which is endurance, dynamic resistance, isometric resistance training is very important, which they found in their study. And then again, limiting alcohol consumption they found as being a risk factor for hypertension. And so the question is, diet plays a significant role in managing high blood pressure, and foods that are, diets rich in fruits and vegetables are really the key to managing blood pressure, which in turn lowers our risk for heart attacks and strokes. And not this type of food, which is the standard American diet. It's highly processed, highly refined, high in salt, high in sugar. We really need to do a good job of avoiding that. So that's kind of the end of my presentation. And let's see. So I want to thank you again for listening to my talk. I don't know how to make myself bigger. Okay. But I want to thank you, and hopefully you listen to more of my talks. Again, if you have any questions, let us know. You can reach out, ocsportsandwellness.com or 949-460-9111. And again, thank you for listening, and I appreciate you taking time to listen to what I have to say. And I think it's very important.